BPH has a negative impact in the quality of life, and also have an impact in economics because it will provoke economic burden. Most common disease that the men are suffering after 50 years old, all world around. And finally, sexual function. It is very connected, it is very related to BPH. This is a benign disease and the patient must be included to make the decision. So these three techniques, what it's doing is open a channel through the prostate to relieve the obstruction and to let the urine to run faster from the bladder to the urethra to prevent the complications and to improve the quality of life. The other strategy we can use is to do enucleation. If you look at the American Urological Guidelines, they are very similar. They split it in large, average or small prostates, and if you look at it, the enucleation of the prostate is always included in the three arms. What is TIND? TIND is a temporary implantable nitinol device that provides a minimal invasive means of increasing prostatic urethral patency to relieve the symptoms of urinary outflow obstruction secondary to BPH. And the advantage of this kind of devices is that you can implant it with a cystoscopy. This is a rule that we have developed, that if the prostate is less than 2 centimeters of length, you will need 1 or 2 injections. If it is between 2 and 3, you will need 2 or 3 injections. If it is longer than 3, you will need 3 or 4 injections. The functional results were really good, with a decrease of the IPSS, and the complications were lower than in TURP, so it seems to be a very safe and effective treatment. In conclusion, we can say that the urethral lift is a minimal invasive treatment for BPH, that short functional results seems to be effective, that the sexual function seems to be preserved, including ejaculation. It can be a choice for selected patients, and further study might be carried out.